Ways how you could fight diabetes. Among the very important reasons that you ought to do whatever you can to manage diabetes is because this disease can grow into other more severe ailments. For instance, diabetes can cause heart disease and also increase your probability of becoming cancer. Take advantage of these hints to manage your diabetes. In case you are craving French fries however are watching your own weight thanks to diabetes, try sweet potato chips. Slice a sweet potato and sprinkle salt, pepper, and additional spices about it. Cajun spice mix also works nicely. Bake it at 425 for about 30 minutes and you will have sweet, tasty chips to eat. For those who have diabetes afterward, alcohol isn't your companion. Alcoholic drinks are filled with sugar and that won't help your blood sugar. A glass of wine has more sugar than hard liquor and beer may has less sugar than just wine however significantly more than liquor. It can be hard to find enough exercise when you are traveling, so plan for several trekking or walks to research the new setting. Move swimming at the hotel swimming pool, or take an hour or so at the gymnasium. Walking through the mall along with a museum can also function as a few extra movement. To maintain your blood sugar from spiking, research high glycemic index food items. If you are not knowledgeable about what ingredients you should avoid, you may have something harmful without even realizing it. In the event you have to eat something fast and do not have enough time to check this up, stay glued to non-processed food items. Check to determine whether your food store lays out things that are near their own due date to get clearance. Many times, you can use such things as ripe bananas for sandwiches or banana bread, and you also can discover awesome sugar-free and low-carb snacks to get both foods on the web. It's important to receive a sufficient amount of sleep in the event that you are afflicted with diabetes. Lack of sleep can interrupt your hormones, which then can raise your blood sugar. If you discover that you have tried everything for more sleep, but only works, talk with your physician for additional alternatives. For those who have problems with diabetes, attempt to take a multivitamin with minerals, vitamin C and chromium each and every day. All these have all been shown to keep your blood sugar at a reasonable amount. Just don't forget that those ought to really be taken alongside medications, perhaps not as a replacement for them. Smoking is not healthy for anyone but can be more unhealthy for an individual who has diabetes. Smoking makes individuals insulin resistant, therefore the probability of acquiring diabetes increases if you are not diabetic to start out with. If you are diabetic, you want to become taking extra care of the toes. Make certain that you are cleaning them and perhaps not putting any extra strain on your own feet. That means not standing for extended intervals doing anything too strenuous. Whenever you have diabetes, there are several ways that one can lower your consumption of sugar levels. Instead of a sugar-laden tender beverage, drink a portion of sparkling water. Replace a full bowl of fruit for a plate of strawberry ice cream. Instead of a piece of cake, like a piece of cheese. Substitute a spoonful of apple to get a serving of apple pie. Reducing weight and increasing your workout can significantly lower your chances of advancing from impaired glucose tolerance to full-blown diabetes, thereby controlling and enhancing your own life. For effective diabetes control during diet, then regulate the amount of food that you eat. Avoiding overeating keeps your blood sugar out of skyrocketing and causing issues, because the amount of food that you eat affects just how much sugar is in blood. Do not eat too little, either, though, because that sort of imbalance can also cause disease. If you are diabetic and you also smoke, it's important that you take the actions to stop smoking. Smoking causes the circulation to become inferior, and a correct circulatory system is absolutely essential to get a diabetic. Talk with your physician for help stopping smoking, and there are many aids to help. When you have diabetes and crave sweets, simply make sure you eat them in moderation. This is a myth that diabetics can't eat any sugar at all. However, it's correct that diabetes means you have to eat up sugar free of care. If you are a diabetic hunting exercise, Then make certain that you stay away from any exercises that want the strength training and pushing or pulling heavy items. In this type of exercise, both blood pressure and blood sugar levels are raised that can lead to many harmful health factors. Many men and women, once diagnosed with diabetes, quit eating sugar and genuinely believe that is adequate. However, what the majority of people do not understand is that fatty meals can be equally as dangerous to diabetic patients. If an individual cuts sugary and fatty foods, diabetes can actually be treated and an individual can add many years for your own lifetime. If you are a diabetic, make certain that you have emergency equipment with you. Make certain that you pack an extra sugar meter, insulin, lancet, test strips, syringes and also wipes. Hypoglycemia can be treated with sugar tablets, and such tablets can be kept for a long time. Keeping things such as this handy can guarantee that you have a safe adventure. An ideal way to carry those items would be really a fanny pack. Failing to manage your diabetes will lead to increased chances of heart disease and blindness and also other life-altering and life-threatening ailments. Make use of the hints using this article as a way to decrease the risks. Put in the time and effort today, therefore, that you never wind up regretting your indecision later. Diagnosis. Type 2 diabetes is usually diagnosed with this blood glucose test indicates that your average blood sugar level for the past 2 to 3 weeks. Normal levels are below 5.7%, and effect between 5.7 and 6.4% is believed pre-diabetes. An A1C degree of 6.5% or more on 2 separate examinations means that you have diabetes. When the A1C test is not available, or if you have certain circumstances, such as a rare sort of hemoglobin, referred to as a receptor variant, that restrict A1C evaluation, your physician may use the following evaluations to diagnose diabetes. Random blood sugar evaluation. If a fasting blood sugar levels is 126 mg/dl, 7 mmol/L, or high on 2 separate evaluations, you have diabetes. Oral glucose tolerance evaluation. This evaluation is much not as widely found than others, but during pregnancy, you should fast overnight and subsequently drink a sugary liquid at a physician's office. Blood sugar levels are analyzed periodically for another 2 hours. A reading of 200 mg/dl, 11.1 mmol/L, or maybe more after 2 weeks suggests diabetes. The American Diabetes Association recommends regular screening for type 2 diabetes start at age 4-5, especially if you're overweight. If the answers are normal, repeat the evaluation every several years. In the event the outcomes are borderline, ask your physician when to keep coming back for another test. If you are diagnosed with diabetes, your physician may perform other tests to distinguish between type 1 and type 2 diabetes, since both conditions usually need various treatments. A1C ranges will need to be assessed between 2 and 4 days a year. Speak about your target A1C goal together with your physician, as it may vary based upon your age and other factors. An elevated A1C degree may signal the demand for a change in your medication, meal plan or activity amount. It's preferable that the intake of carbohydrates stems out of products such as fruits, vegetables, beans and whole grains and dairy versus those demand the added participation of salt, fat or sugars. 10. Indicator and glycemic load. There's large confusion at the interpretation about the consequence of this daily diet using low glycemic index, and there isn't unanimity at the outcome of different research studies. Though these diets are advised by several associations because there are studies from that have been detected a far better glycemic control if it's compared above all with high glycemic index food. 29. There are articles that have contested this assertion. They based this divergence on the various definition of glycemic index. They usually do not take into account the fiber donation and different glycemic reaction to precisely the same food in various individuals. They believe that cannot be determined that the observed impact is only due to this food glycemic load. Fiber, dietary fiber intake. especially the fiber that give you the natural resources, has proven that improve the utilization of cardiovascular risk factors, and improved the glycemic control, changing into a diminished risk of cardiovascular mortality in people who have diabetes. But some studies have proven that the result on diabetes has a small significance and it's achieved with elevated amounts of fiber a day. However, this really is far away from a real ingestion in daily life, greater than 50 grams/d32. Generally, and taking into account the little beneficial effects on cardiovascular risk factors, in diabetic patients has been indicated a consumption of fiber and whole grains at least similar to that advocated for the general population, about 25 grams/d for ladies, and 38 grams/d for adult men, approximately 14 grams per 1000 kilocalories. Sucrose and fructose. Contrary to what you may think, sucrose intakes about 10% to 35% of total energy don't have a negative result on glycemic or lipid reactions when sucrose is substituted to get isocaloric amounts of starch. Eat up completely free fructose, naturally occurring from foods such as fresh fruit, failed to have worsen with the glycemic control significantly more than several other kinds of sugar, although it will avoid additional intake of 12% of daily calories. 28. Psychotherapy is advised of those sugars from the diet to help avoid excessive caloric intake that can promote weight gain should are taken in large quantities, especially harmful if you are sweetened with fructose totally. Although there are not many reports from diabetic patients, there's no reason to think that they are not going to have exactly the same consequences. Hence, the ingestion of the beverages is contraindicated. Non-caloric sweeteners, opposite of natural straightforward sugars, that there are sweeteners with lesser calorific value. All are artificial. They don't have caloric donation, but aspartame, containing 4 kilocalories/g, and usually do not increase blood sugar. Should they are utilized to replace sugar, bring the main benefit of reducing the kilocalories from your diet. Proteins. It really is fascinating to make a differentiation between diabetic patients with and without liver disease. In individuals without liver disease, protein intake usually advocated is between 15%–20%. Nonetheless, estimating scientific tests, no firm decision can be reached depending on the situation. From the literature we can discover different randomized clinical trials faced with this dilemma outcomes. On the one hand, there are studies that demonstrate that when 28% to 40% of their vitality of this diet plan is taken as carbohydrates, there's an improvement of those A1C, triglycerides, total cholesterol and or LDL cholesterol 3/6, whereas the other studies have demonstrated a benefit in any one of those aspects. In patients who have kidney disease, if we reference or macroalbuminuria, reducing protein intakes below the usual has been experienced various evaluations and meta-analysis, and evidence has not proven that improved glycemic control, cardiovascular risk factors or renal disease development after low-protein food diets. With regard to the source of proteins, there's absolutely not any gap between animal and vegetable source in relation to proteinuria. Phenolith proteins in patients with T2DM, even although they don't have effect in blood sugar control itself, seems to increase the insulin response. Therefore it's not advisable to utilize proteins in most situations of hyperglycemia. Fat. Epidemiological studies have related fats with all the probability of developing obesity and cardiovascular hazard. As in the others of immediate maxims, there isn't any optimal fat percentage and, as a general rule, the recommendations to the general population, between 20% to 35%, are applied for diabetic patient, paying special attention in the event the patient is overweight, then your percentage needs to be at the reduced limits. Despite those recommendations, diabetic patients tend to take more fat than those advocated. In addition, has to be given that trans fatty acids may become a kind of unsaturated fat, however with harmful consequences on the human anatomy because of its different arrangement. Differentiating between those kinds is important because it has been demonstrated that the quality is much more relevant than the amount of fat absorbed. There are only a few studies from diabetic patients about ingestion of saturated fatty acids or cholesterol. In this regard, the recommendations for patients who have diabetes are exactly the same as for the general population: a donation of saturated fat 10%, with a minimum intake of trans fatty acids, and also a donation of cholesterol 300 mg/dl10, preferably opting monounsaturated and polyunsaturated fatty acids, like omega-3 fatty acids. But, ingestion of products saturated in omega-3 can stay favorable in preventing cardiovascular disease. Alcohol ought to be drunk in moderation, and it will not exceed 1 serving per day for females, or 2 portions every day within case of people. In order to avoid excess of energy once they are absorbed, this donation has to be exchanged for different products. This moderate ingestion doesn't harm the glycemic control, but rather in certain studies has been uncovered the contrary. Together with moderation can improve glycemic control and reduce cardiovascular events. Regardless of the above facts, it's extremely important to be aware that alcoholic beverages may promote the appearance of late hyperglycemia, especially in patients in treatment using hyperglycemic medication. Thus, we ought to warn the patient to pay attention to any signs of hyperglycemia. If these also have hypertension, that is common, reduced sodium intake needs to be individualized. Certain supplements. The potential advantages of dietary supplements for diabetic patients using various specific nutritional elements have been exposed to trials. Despite the reliable data has not yet been discovered to ensure benefits in glycemic control because of nutritional supplements. The daily diet with antioxidants as vitamin and carotenes, micronutrients such as vitamin or alternative herbaceous plants. Exercise boosting exercise, in just a certain plan, provides general terms multiple benefits: increased insulin sensitivity in cells, improvement of glycemic control, benefits in lipid profile and blood pressure, maintenance or fat reduction, cardiovascular advantages, high quality of life, psychological well-being and improvement of melancholy. The gap in the level of improvement seen in different studies will be contingent on the characteristics of the patient and the sort of training. Therefore, it's more efficient when training programs are based on aerobic exercises of programs based on muscle strength in isolation. Additional benefits: the physical activity also brings improvement into additional metabolic parameters. It will help restrain cardiovascular risk factors, dyslipidemia, hypertension, and weight maintenance. Psychological advantages: reduces mortality, improvement cardiorespiratory, cardiovascular and peripheral neuropathy. Kinds of exercise: both aerobic and resistance exercises have demonstrated benefits in people who have diabetes through increased sugar uptake and decreased insulin resistance. Though aerobic fitness exercise in isolation appears to get much better benefits than resistance training, in patients who have diabetes is advocated the combination of both types because the result is significantly greater than when each person is achieved in isolation. Such a training has been traditionally suggested for patients with T2DM. A frequency of at least 3 per week is preferred, preferably when it can be increased to 5 with no longer than 2 successive days between periods of activity, because the increase in this sensitivity and the sugar tolerance is maintained for about 12 to 24 hours. It ought to be carried out with moderate intensity, that's 40% to 60% of maximum aerobic capacity. Another means for measuring the seriousness can function as abstract understanding of this endeavor that assigns values into 20 factors according to this patient conclusion about the activity completed.